Well, welcome to Skills Day. This is a quick introduction for you guys in regards to wound vacs and both inpatient, outpatient wound vacs and some kind of troubleshooting ideas for you. This is Tina Schultz. She's one of our PTs that helps with wounds, and I'm Sarah Anderson, one of the other PTs. So you'll see us floating around. We can help whenever you need to for wound vacs. So we're going to get started, and we're going to first just do a little bit of basic wound vac anatomy, give you guys some general ideas as to what dressings we use and different canisters for both inpatient and outpatient. Okay.
So first we're just going to go through a dressing packet. So this is what it looks like when it comes in the package. You may see these in a patient room or things like that. So these are the kind of basic dressing package. And when we open this up, there are a few different items in here that we use for wound vac dressing changes. So in every package there is plastic draping sheets like this. There is foam. So some of the different packages have different styles of foam, but this is probably the most common one you'll see. Measuring tape. And then the Sensitrack tubing, which is what connects the dressing on the patient to the wound vac machine. And then on the Sensitrack tubing, you'll also see some clamps like this. So the way those work is you would just pinch it to close and then pull it to open. So those are useful when trying to disconnect from one machine and connect to another, or assisting a patient to the bathroom or getting dressed and undressed, those sorts of things. So that's kind of the basics of the dressing package.
I would add to these, so this is what we call the black granufoam. So any of our black dressings, these are black granufoam dressings. And then you may see us use occasionally for packing of wounds, you may see us use the white foam, which is just a little bit different. It comes in a different package. The white foam is wet, so it's moist, it's smaller, so we just cut the section we need for packing those wounds when we want to use something a little bit different as opposed to the black granny foam. Oftentimes we will use both together. If we're packing the wound, so the white would go on first and we'll put the black over the top of that.
Okay, so this is the inpatient wound vac. This is what it looks like. So this is stocked in Rehab. And then to turn this one on, there's a power button up in the corner. So you'll just hold that until the light turns green. And then it does take a little bit for the machine to fully fire up. So while that's working, a few other things that we'll show you on this inpatient version of the wound vac. So on the back side here, there is an IV pole hookup. So this can pull out like this so that it fits right around your IV pole, and then you can tighten and lock it into place. These do need to be attached to an IV pole or up off the floor when they're up on med surg in a patient room. And then we'll come around to the other side here. So this is the charging cord for the inpatient vac. It's two pieces, so they connect right there as Sarah's showing you. And then the connection to the vac is down here, and there's an arrow on that plug that lines up nicely to show you how to plug it in so that it stays charged.
You can unplug it, and so a patient needs to go to the bathroom or needs to go take a shower or do something like that, you can unplug it for a while, but we do ask that you try to keep it plugged in a majority of the time, just so it doesn't run low on battery.
And then the other portion on this side, so this is where the wound vac canister would be applied. So again, for the inpatient wound vac, there is an inpatient canister, so this is larger size, comes in that sort of a packaging. And then when we open this up, you can see it's kind of oval shaped. Just take the extra tape off here. So this, just like the other tubing, also has a clamp on it, which closes and opens in the same manner. So So again, if you would need to change the canister or help the patient put pants on or off, run to the restroom, take a shower, you can clamp that tubing while they're doing those things if needed. So the canister is oval shaped. You can see the numbers on the side over here, and then in order to attach that, you'll just come over to the side, make sure you have it upright, and then it kind of just snaps into the side like so. So it should look like that once it's all connected. And then when you go to hook it up to our patient, this is the end that would be attached to the patient's dressing. And then you can see here, we just kind of slide together and twist to lock, and then the machine is connected to the patient's dressing. We just make sure the clamps are open on both ends, and then it's ready to run, okay? So then, once the machine is on and running, the startup screen will show, and when we're ready to start the therapy, we just hit continue therapy. So as you can see here, the machine is stopped because it's not hooked up to a person right now. So some of the features on the screen here are the start and stop button. So you would be able to stop the vac therapy if you were, again, going to get a patient dressed or up to the restroom or take them to the shower quick, things like that. This would be the start and stop button. You just want to make sure when you reconnect their tubing that you hit start so the machine continues to run. The other button that's helpful is the seal check button. So the seal check button will give you an idea of how that seal is working on the patient's dressing. So when we click on that one, if there are issues or alarms, that will kind of guide us and let us know when we regain our seal on that dressing.
So if you hit start, if we hit start, we'll be able to show you that we are not able to maintain a good seal at this time. So you can see the screen. It's going to make a lot of noise. It's going to be, I think it's nice and yellow on there. So we know that we have an issue going on somewhere with the seal, and we need to figure out how to create increased suction or seal around this to get it to come down. You know, and so sometimes it's just applying more drape, more of that clear plastic adhesive dressing around the area somewhere to see if if it's leaking somewhere, but we want to get it to seal. So
as you can see, Sarah's kind of applying pressure there to seal the vac. So now we're in the green, and that tells us that our machine is working properly. So this again is the seal check, kind of a way to just keep tabs on how that dressing is holding up. And then the other button down here in the corner is therapy settings. You should not need to adjust to that. That should be set by the clinician or provider who applies the wound vac. Sure. So the last thing to show on the inpatient wound vac here is how to remove the canister. So if the canister fills up with drainage from the wound, then the machine will alarm and tell you the canister is full. So at that time you can pause the therapy or stop the therapy like we talked about, remove the canister, put on a new one, reconnect it like we talked about to your patient's tubing, and then start the therapy again. So to remove the wound vac canister, we'll assume this one's full. So there's an eject button right up here in the corner. So you're just going to push that, and then the canister will pop right off the side. You open your new canister and attach it like I showed previously, and restart the therapy.
all right, so this is our outpatient wound vac. We do house one of these down here in rehab. However, it's important to know for our outpatients that these require insurance authorization before we can apply these to patients and send them home. But just so you know, we do have these to be able to help get those vacs on patients a little bit quicker. So the machine will come in this black case. It has a blue bag that comes on the top. This is important for the patient to remember that they keep this case as well as keeping this blue bag. So when we are all done with therapy, this whole unit goes in this blue bag, and then UPS comes and picks it up, or you drop it off at a UPS location and it gets mailed back. So really important for us to educate patients not to lose this. So when we get this, the information will come with booklets for patients, obviously some various other papers. It comes with this nice black bag. So black bag will be for patients to put the outpatient vac in for being able to carry it around. So it comes with that. It will come with its charging cords. So 2 pieces of charging cords. These just plug together, and then they plug into the machine on the side. And then the outpatient machine looks like this. There's some slight variability in the machine, so some of the models are just a little bit different, but in general, they're all the same. They all function pretty much the same. But your charging cord does plug into this small little hole here on the side. So outpatient vacs don't have to be plugged in all day, but they all last anywhere from, I would say, 6 to 8 hours on average for battery life. So we just encourage patients to plug it in when they can, and to make sure that if they're traveling anywhere to take the power cord with them. So outpatient vac looks like this. And then this is what the wrapping looks like for the canisters. So it'll come in a little bit different wrapping as opposed to the other one. And then the canister itself is smaller. So if we compared inpatient to outpatient, the shape is different, the size is a little bit smaller. These are 300 milliliters versus 500 milliliters. So for attaching the canister, it's just going to snap together, so you have your 2 parts. So you're just going to push it together until you hear it click. So now your machine is up and running. And then again, you can take your tubing. So if you look at this canister, it comes with a little hard cap on the end. So that cap is just for protection. I think initially we won't do anything more with it. You'll take it off, so you just twist it to take it off and pull it off, and then you can discard the cap. And then again, as that reminder for your dressing, you'll take the 2 ends again. You'll see how they kind of line up, and then you'll push them together and just twist it so it locks. So then you've got your dressing hooked up to the canister. So again, for this one, for turning it on, you'll hold the power button until you see the screen come on. They take a few seconds to come up and start working here. Once it comes on, you're going to get this warning screen, and you can just hit OK through the warning. And then you're stuck with a couple buttons here, so it's going to look at on, off, and audio pause. So when you're ready, once you're hooked up, you'll just hit the on button. My settings technically are already set for the patient at this point, but you can tell it's making a bunch of noise, so obviously something's going on in through here. That sounds much better. With this machine, if you need to get to it, so this will lock, the screen locks so that the patient can't go in and change anything. So you're going to have to hit this question mark button here. And then from there, there's a section up here in the corner. It says clinician mode. So you'll hit the clinician mode, and then you actually have to hit this OK button and hold it. So you got to hold it for about 10 seconds.
Can you bring it down? I'm getting some glare. There you go. Thank you.
Yeah. And then from there, if you wanted to look, it's hard to see this screen a little bit, but there's an on-off, utilities, and therapy. If I go to therapy and hit next, I can look at settings if I needed to change them. In your case, you're probably going to look at seal check. And seal check's going to tell me that, oh, we're still a little on the high side. And you can hear it's making that nice beeping. So sometimes you'll get those alarms. Those will be the alarms you might get from a patient. And once we get the seal set, it'll go back down. So to get back out of that screen, you can hit that question mark button again and hit exit. And then you can hit exit again. And then you gotta hit the question mark button to get back out, and I would go back to patient mode and just hit OK back through there. So now it's locked for the patient. They can't go back in and accidentally change the settings again. To remove the canister, so I need to take the canister off now. I'm going to turn the machine off. I'll hit the off button. And then again, you'll want to do your clamps, so pushing your clamps back down again. And then you can unhook if you want. And then for this one, there's a little lever here. So you'll just push the lever down and then you can pull the machine right off. So that's the outpatient vac.
Whenever you're ready.
Okay, so the last thing we want to touch on today are some common alarms that can go off on the inpatient or outpatient vacs, and then some troubleshooting things related to those. So there are about 6 common alarms. So you heard in the previous videos the alarms going off on both machines. So when you hear that alarm, you'll go ahead and look at the screen, and then the alert there will tell you what the issue is. So first one would be low pressure noted, so the machine will say low pressure. So if that is the case, things that you can check would be the tubing here, so making sure that you don't accidentally have one of the clamps set that needs to be opened. So again, there's a clamp on the patient end as well as the canister end. Also making sure there's no blockages in the tubing, it's not kinked, stuck under a chair leg, or pinched in the bedside rail or things like that. So those would all be ways to check the low pressure alarm. The next alarm that the machine would tell you is that there's a blockage. So if it says that there's a blockage, similar things, making sure that your clamps are open all the way, there's no kinks in the tubing, there's no drainage or anything that appears to be kind of clogged through there, and not pinched, on the bed or chair, etc. Patient isn't sitting on it, things like that.
I would say most commonly with that one, we'll see either it get blocked where the tube enters the canister, and sometimes the only way to resolve that is to change the canister. The other place we'll see it sometimes is right at the dressing where it meets. And so sometimes what we can do there too is just work on manipulating a little bit, whether or not we're just kind of squeezing it around a little bit or trying to just maneuver it a little bit to see if we can get whatever might be blocked in there to come out. Typically that helps, but clearly if that's the problem, sometimes the only way we can resolve it is to change the dressing.
The third alarm you might hear is leak detected. So again, the screen will say leak detected. So things to check when you get that alarm would be that your canister is fully engaged on the machine. Instead of just resting there, this should be a little bit more snugly attached. So making sure the canister is fully engaged, making sure that your tubing is properly connected. So again, if this is not twisted all the way closed, things like that, making sure that's properly connected. And then utilizing some of the extra draping. So as Sarah kind of showed earlier, when that dressing is on the patient, if a leak is detected, that can indicate that there's a wrinkle somewhere, or maybe the patient moved around a little bit and peeled up some of the draping. So the way to correct that would be to use the extra draping from the dressing package and kind of do some patching there. Then another possible alarm would be battery low. So for that, just making sure that you plug the machine back in. Both inpatient and outpatient need to be charged to operate. So plugging it back in and making sure the machine stays well charged. The next one would be canister full. So if the canister fills up with drainage from the wound, it will alarm you, say the canister is full. So then your job would be to change the canister. So we kind of talked about that with both the inpatient and outpatient vacs as far as how to correct that. And then the last one would be therapy inactive. So if for whatever reason you pause the wound vac therapy, say to take the patient to shower or to the restroom or to get dressed, if the therapy remains inactive for a certain amount of time, then the machine will alarm to let you know that it's not running. So that is a nice feature. If you do happen to do one of those things and forget to restart it, the machine will alarm to let you know that you didn't restart the back therapy. So to do that, you would just hit the start stop button, that green button that I kind of showed you previously. And then if for whatever reason the therapy remains inactive for up to 2 hours, that's when we would just say go ahead and remove the dressing. We don't want that wound vac dressing sitting on the patient for longer than 2 hours at a time without the machine actually running.
If you've gone through all of the troubleshooting tips that we provided with you and you still cannot get the machine to work, then we would ask that you contact KCI. So assuming that it's after hours, therapy is not here, we would ask that you contact KCI. So they do have 24-hour customer service. You can find the numbers easily on the machines. So in this case, under the canister, there's a big 1-800 number on there. The outpatient vac has it listed on there. So you have multiple locations of which you can find the phone number for KCI. We just ask you call them. They'll walk you through everything that needs to be done. And in the end, if they still cannot help you with troubleshooting to get that wound vac to work, then that is like what Tina mentioned. We'd ask that you take that dressing off. So just remove the entire wound vac dressing. And then standard would be to just apply a wet to dry gauze dressing over it, keep it covered, and then you can contact therapy when we come back in the morning, and we'll come in and look at that dressing again. So that would be that recommendation. KCI is really helpful, so I think you'll find it beneficial to talk to them if you are running into an issue.